Hello everyone. Today I would be discussing about colorectal cancer. So colorectal cancer is a cancer of the large bowel and rectum. It starts in the inner lining of the bowel called the mucosa, where abnormal cells cluster and form a polyp, which ultimately grow into cancer over the years. So if we catch cancer early, we can treat it for cure. Usually the colon cancer affects age group above 50. But nowadays we are seeing more and more younger patients being affected by colorectal cancer. So it is pertinent to catch the disease early and treat it for cure. So what are the risk factors associated with colorectal cancer? So if there is a family history or there is a history of syndromes like familial adenomatous polyposis or Lynch syndrome, or if there is history of inflammatory bowel disease, or if there is family history of cancer, then one should come for consultation earlier. And if there is diet of which is lacking in fresh fruits and vegetables, if it is high in red meat or processed meat, or if there is excessive smoking or excessive alcohol intake, or if there is a sedentary lifestyle, or if one is obese. So all these factors are risk factors for colorectal cancer. So how do we diagnose colon cancer? So initially we can do some stool tests, some routine blood tests, and the most importantly a colonoscopy, which is a telescopic examination of the large bowel through the back passage. And if any abnormal cluster of any abnormality is seen, or any ulcerated lesion is seen, that can be biopsied, or any polyp which is seen, that can be removed and biopsied. Once the diagnosis is made, then one can do further radiological tests like a CT scan of the abdomen or a PET CT and MRI of the pelvis. Once the diagnosis is made and the staging is done, then one can plan treatment, because treatment is according to the stage of disease. If it is early stage, surgery is the treatment of choice, and it can be done minimally invasively or by open method. In minimally invasive, we can do laparoscopic or robotic surgery, where a segment of bowel is removed and joined. If the disease is advanced, then chemotherapy is added, and either before or after, and similarly radiation is added either before or after surgery. And if the disease has spread, then one can do chemotherapy, targeted therapy or immunotherapy based on the molecular tests done on the biopsy specimen. So in the end, I would say that if we catch colorectal cancers early, we can treat it for cure. And also we should spread awareness if we have any of those symptoms to consult a doctor so that we can catch the disease early and treat it. Thank you.